Hi guys, this is a video on verification jig. I would be making a detailed video on verification jig soon, in which we will discuss in detail about what different types of verification jig and how to correct a verification jig if it goes wrong, and why your verification jig is fabricated in the first place. So this is a case that had reported to the clinic that I go for consultation. So I just wanted to show you how it is done. Over here, they have used the final abutment as the verification jig. So you can see that they have finalized an angulated abutment, and they had connected it with patent resin, which is adapted to the mesial canine over here. So this is how a verification jig would be fabricated. This verification jig is usually done to evaluate if your impression is perfect or not. So if you're once you get this verification jig from the lab, or this process or the step which you're calling your patient for will be also known as jig trial. So all you have to do is go ahead and remove the healing cap and position this jig in place as it was shown in the cast. So once you have fastened the abutment onto the implant, you're not supposed to see that small gap that you are seeing in between the jig and the tooth. At the same time, once your abutment is tightened, please make sure that you take an X-ray. So once it's tightened and you can see that the perfect fit, there's no gap there. If there is a gap or if there is a discrepancy in the X-ray, please go ahead and make a new impression. If everything is sitting fine, then make sure you can inform the lab that the lab can proceed with the existing cast and get you the final crowns. So see you guys in the next video. Till then, goodbye.